Hello, everyone, and welcome to Lancaster Safety's Webinar Wednesdays. My name is Holly, and I'm a project coordinator with Lancaster Safety. I'm joined today by Lauren, a scheduling coordinator for today's presentation on preventing the spread of illness in the workplace. Each month, we host a different safety or health topic in an effort to enhance workplace safety nationwide. We know that you don't want your employees or coworkers getting hurt or sick at work, and we commend you for taking the time to attend this webinar today.
Yes, we certainly do. Now, we know we have a lot of attendees that are regulars here with us, but we'd like to take the time to introduce ourselves to anyone new in the audience. At Lancaster Safety, we pride ourselves on being a comprehensive OSHA compliance company with a central mission of ensuring the safe return of every employee to their loved ones after each workday. Our aim is to cultivate a safety-oriented culture among our clients, where safety is a voluntary choice rather than a mandatory requirement. Our dedication really lies in delivering exceptional service that genuinely transforms lives. Now, let's get into an overview of what we plan to discuss today.
Thanks. I'm happy to get the ball rolling. So today we're going to focus on a topic that has been very prominent in the news these last few years. We have all seen how quickly a disease outbreak can reach global proportions, affecting a large number of countries and people.
Yeah, absolutely. And even new viruses can emerge from anywhere and quickly spread around the world, causing sickness, lost workdays, closures, and even fatalities. Even a common illness like a cold or the flu can spread like wildfire. So how do we focus on preventing the spread of illnesses?
Today, we're going to focus on small, simple changes that you can implement into your workplace routine that can significantly reduce the number of lost workdays due to illness. Sounds pretty good, right?
Sure does. I also want to mention why managing illness in the workplace is so important. OSHA has been known to be synonymous with safety, but do you know what the H in OSHA stands for? It stands for health. That's right. OSHA regulates the safety and health of workers all over the United States. One important aspect of an employee's health is keeping them safe from the spread of disease, which is, of course, easier said than done, right? Now, our listeners might be wondering, is there a specific OSHA standard dedicated to illness prevention?
That's a great question. And the answer is that at this time, federal OSHA does not have a specific standard designated for the spread of infectious disease or illnesses. However, there are still others that may apply. For example, employers must reference the personal protective equipment standards, as well as the respiratory protection standard. Lastly, they will also refer to the General Duty Clause, Section 5A1 of the OSH Act. This requires employers to furnish employment free from recognized hazards that are causing or are likely to cause death or serious physical harm. You may have heard us mention the General Duty Clause before, and that's because it's so important. The General Duty Clause is a catch-all, so to speak, to ensure employers are doing their best to keep their team safe on the job, even when a specific standard isn't written out.
OSHA has remained stern in its commitment for employers to comply with OSHA regulations. In the event that a worker contracts a virus while on the job, an investigation regarding the previously mentioned standards would likely result. Was an exposure assessment performed? Were appropriate control measures implemented? Was personal protective equipment made available to employees, and were they trained on its use? Answers to these questions should all be documented and available for review.
When we say document viral-related cases in the workplace, we're talking about OSHA's record-keeping logs. OSHA requires businesses to keep records of their injury and illness reports. If you are in charge of your company's record-keeping logs, let's briefly discuss record-keeping for illnesses.
Let's start here. It can be difficult to determine if an exposure is work-related. We understand that, as record-keeping questions are our #1 most asked topic. LSCI is happy to assist you with all of your record-keeping questions. Just ask. Here's a scenario for you. You or a coworker is sick and thinks you picked up something at work. What are the questions an employer or a record keeper should ask?
You'll want to ask these questions. How do you think you may have contracted the illness? Has anyone around you outside of work been sick? Have you traveled anywhere or attended a large event recently? The evidence that an illness was work-related should be determined based on the information reasonably available to the employer at the time of determination. However, if the employer later learns more information related to an employee's illness, then that information should be taken into account as well in determining whether an employer made a reasonable work-related determination.
So far, we've reviewed the applicable OSHA regulations related to illness and information on recording work-related cases. Next, we'll review the illness control measures, including stopping the spread of illness, reducing their occurrence, and better yet, preventing them from entering the workplace.
Like many of OSHA's other regulations, we'll start with the hierarchy of controls. If you have never heard of OSHA's hierarchy of controls, it's a control system used to prioritize and implement safety measures and controls to protect workers from occupational hazards. It consists of 5 levels of categories arranged in order of effectiveness for hazard mitigation. If you look at this graphic, the most effective level starts at the top with elimination, then substitution, then engineering controls, and so on. It would be pretty difficult to eliminate or substitute illnesses, right? So let's start with engineering controls.
I wish we could eliminate illnesses completely, but in this case, engineering controls are the top line of defense. Controls such as high-efficiency air filters, systems to increase ventilation rates in the environment, leaving doors and windows open to allow for natural ventilation, and installing physical barriers or partitions are all examples of controls designed to engineer out this hazard. This picture shows a barrier one of our clients actually makes.
That is so cool. Next, we have administrative controls, and there are a ton of them that can be implemented based on what works best for the organization. Here are some examples. First up, we have maintaining adequate distance from all person-to-person interaction. You can also hold meetings and other work remotely when possible in order to avoid close contact. Next, we can establish or alternate days or extra shifts that reduce the total number of employees in a facility.
You should also encourage respiratory etiquette, including covering sneezes and coughs. You can hang posters around the workplace as a good reminder to employees. Also, encourage employees to avoid touching their eyes, nose, or mouth.
Whether coughing, sneezing, or touching their face, it is crucial for employees to wash their hands. Provide frequent visual and verbal reminders to wash hands with soap and water for at least 20 seconds. If you need something to remember the 20-second rule, sing the happy birthday song through twice. Posters are also a great visual reminder. Here are a few examples of notices that companies have placed at their workplaces to help communicate their policies and response to workers.
All of these visual reminders are helpful to employees, but where does all of this information start? Training. Train all employees on risk factors, protective behavior, and PPE, including how to wear, use, clean, and store it properly. Without performing these functions accurately, PPE is nearly useless.
Let me ask, who here likes to clean? Even if you said not me, the importance of enhanced cleaning measures can be so helpful in reducing the spread of illness.
Companies all over the US are enhancing their cleaning measures, including setting alarms for frequent scheduled cleaning, adding additional cleaning measures, providing hand sanitizer throughout the workplace, using no-touch disposal receptacles, adding hand washing signage, and making disposable wipes easily accessible. Make sure that you are using appropriate cleaning measures for your workplace.
Some cleaning and disinfecting measures that you can do include thoroughly clean high traffic areas, frequently clean and disinfect commonly touched surfaces, clean touchable surfaces between shifts or users, whichever is more frequent, use products that are approved by the EPA. You also need to be aware of the harmful effects chemicals can have when used unsafely. Let's take a quick break to watch this video on the 16 sections of the safety data sheet.
Most chemicals can be hazardous in some way, so it is important to know what we are dealing with, at work and at home. A safety data sheet, or SDS, is a document that goes over occupational safety and health information of a chemical product. An SDS is required for every hazardous chemical in the workplace. It is important for you to know the location of your company's STS log and the information contained in an SDS. Here is a list of all 16 sections. Let's highlight a few sections here. Section 2 identifies the hazards. Will it affect the heart, lungs, kidneys, etc.? If so, we'll want to substitute that chemical for something less harmful. Section 7 tells us how to properly handle and store this chemical. Look here for more information. Section 8 tells us the exposure controls and personal protection. So think about OSHA's hierarchy of controls and what you can implement. Now apply this information to your workplace. What chemicals do you deal with, and do you know the hazards? If not, check out the SDS. If you have questions, give us a call at 888-403-6026.
I always like watching those explainer videos. They make training so much more engaging. Next, let's look at PPE, or personal protective equipment, which must be considered after all the engineering and administrative controls are exhausted. This is going to be the lowest and least effective control option on our hierarchy of controls.
Many organizations have published guidelines for the use of personal protective equipment in the medical setting. But what about other industries? Is it necessary to wear the same protective gear that healthcare workers have on if you're not working in the medical field?
The answer to this question goes back to assessing the exposure risk. It is up to the employer to make this decision, but here are a few questions to consider. Is your workplace in an area where illness is spreading? Do your other employees work in close proximity to each other? Do your employees work with the general public? There are a lot of factors that can be assessed, but these are just a few examples. As safety professionals, we'd recommend erring on the side of caution. It certainly doesn't hurt to be too safe. PPE use varies by work tasks, the company's hazard assessment, and the types of exposures workers have on the job. You will be trained on what PPE is needed to protect you from hazards in your work area and what PPE is available, as well as how to wear, use, clean, and store it properly.
We mentioned a few times how posters are a good way to remind and enforce illness prevention in the workplace. That's why we put together this graphic of our top 5 tips. We will send a free copy of this poster for you to print out for your workplace in our follow-up email. Just click the link at download and print. So let's go over these 5 tips. Number 1, you guessed it, wash your hands frequently with soap and water for at least 20 seconds. Don't forget the birthday song. Use provided soap, water, and cleaning supplies. Cough or sneeze into your elbow or a tissue. Avoid touching your eyes, nose, or mouth. And last but not least, take care of yourself emotionally. Rest, relax, and be active. Don't come to work if you're sick. Take time for your self-care and look out for one another. Mental health can impact our focus, which can increase our safety risks around us.
Thank you all for your time today. We enjoyed having everyone, and we really appreciate your participation. Please feel free to contact us at lancastersafety.com or call us at 888-403-6026 with any questions, help with an OSHA inspection, training, written programs, or auditing. If everybody practices these simple tips together, we can help to reduce illness around the workplace. Be well and stay safe.